Hello everyone. Just thought I'll share some information about appendix and appendicitis and what do we have to do if someone in the family has that problem. Appendix as an organ is a vestigial organ, which means that it is not of any use to us in our body. It is a part of that evolutionary cycle that's coming, and the species prior to us had some use for it, but as a part of their digestive system. But in us, it's not of any use, no use for digestion or any other purpose. It is located in the junction between the just after the small intestine. There's a part of large intestine that's called the cecum, and it's generally attached to that cecum. And it's a tubular structure. It's like a tube, blind ending tube, and it's not of much thickness. Normally about 4 to 5 mm thickness is what it will have normally in children. So if there's a problem in that, it becomes appendicitis. Now, why does appendicitis happen? So any infection in the intestines, if they infect that area also, cecum also and appendix also, can cause appendicitis. But one of the common reasons actually of getting appendicitis is getting a fecolith. Now, fecolith is basically a small part of the stools that have got stuck in the entry to the appendix, and now have caused a block to all the secretions and everything, and now the appendix itself has got inflamed and now is causing pain and can cause further problems. So these are the two basic reasons why you get appendicitis. Now, when you get appendicitis, what does the patient actually manifest? The patient can get fever, can get pain, can get vomiting. The fever is like it goes very high, but then it comes down, and then again it rises in the day. The pain actually can be in the center of the tummy or in the right lower part of the tummy. And the vomiting is also, it can be about 2 to 3 episodes in the day. It can be more in severe cases. Now, if a case of appendicitis is delayed, then these symptoms, as we call them, manifest into much bigger symptoms and can be very high grade fever that is all throughout the day. It can be manifested as a lot of pain, excruciating pain, very hard tummy, the person not being able to sit or lie down or anything. There's no comfort posture actually present. If there's very severe, can have sepsis. Sepsis means the whole full body is infected. The organisms that are giving infection from the appendix have spread into the blood and to other organs also. So that kind of a presentation can also be there. Now, appendicitis per se can manifest in these two things, and once for diagnose, these are the clinical symptoms. To diagnose it, we do take assistance of some blood tests as well as some scans. So in blood tests, we'll do some basic blood counts and see that if the degree of inflammation or infection is very high, then those blood counts will let us know that these are the parameters for it. And if on the scan, what we'll be seeing is we're looking at that structure. If the thickness of the structure is more, or if we can see that appendicolith in the appendix, or if there's some fluid or some water or some pus that is sitting around the appendix. And in some, as I told, some severe cases, the appendix can even burst, and even those things can be picked up on the scan. Now, the scan can be an ultrasound scan or a USG scan, or can be a CT, that is a CT with the contrast or a plain CT. All these are used, can be used, and this is tailor-made to the patient itself. Not every patient or every child will require all these things, but most do, and some may require even further investigation. So, keeping the clinical picture, the scans and the blood tests, keeping all these things together, we will get to know whether the patient has appendicitis or no. Now, treatment would be, does every appendicitis require a surgery? And thankfully the answer is no. Not every appendicitis requires a surgery. But yes, every appendicitis will require a set of treatment that would be an injectable antibiotics for some period of time. And if it is early, that is sufficient for it. But sometimes if the patient comes late and it's more severe appendicitis, then we may require to do a surgery. Now that surgery can be done open or laparoscopic or robotic. And in this surgery what we basically do, we will enter the abdomen, go to that area, find out how much of the appendix is actually left, and whether any appendicular mass or any infection or anything is there, and then we will take the base of the appendix, we'll secure it so that we can close that end of the intestine, and the rest of it we will remove. We may have to put a drain in the tummy when we do appendicectomy. If there was a lot of pus or a lot of we thought a lot of infection is there, then we might have to put a tube inside the tummy so as to let the pus drain out slowly over time. And sometimes we don't require anything, and that the removal of the appendix is sufficient. What happens after that is, about a day or two at least, there is no orals given, no food is given to the baby, and after that slowly we will start the food and see how the gut responds, how the baby responds. If there is no vomiting and the baby is passing stools, then we normally send the child home. Invariably about 5 to 7 days of injectable antibiotics, better to give those, and once that is done, we are basically out of the woods with appendicitis. So this is about appendicitis and its treatment.